want to tell you about the joint by joint approach, or kind of how the body works. Got to give credit to Mr. Boyle and Mr. Cook. They're the ones that kind of, and I think Dr. Groves had a hand in it too, of kind of bringing this to light. It really changed my life as a trainer, so I'm just going to share it with you. If you think about how the body works in an alternating pattern of stable segments connected by mobile joints. If that pattern gets broken, that's usually when bad things start to happen. You start to have compensations, mobility problems, injuries, poor performance, things like that. So if you look at the foot, the foot has the arch in it, which is, it's designed to be stable. That's a stable segment of your body. If you go above that, you got your ankle joint. The ankle moves in a lot of degrees of motion, moves a lot, so that area is mobile. So you go above that, you got your knee joint. The knee joint is stable, it only moves this way and that way, and that's it, one way. You go above that, you got your hip joint. The hip moves in all different directions. You go above that, you got your core or your lumbar area. That area is designed to be stable. You go above that to your mid-back, which is your thoracic area. That area is designed to be mobile. That's where golfers and other rotary athletes get a lot of their rotation from, is their mid-back. Then you've got your scapula, which is designed to be stable. Your shoulder, designed to be mobile. Your elbow, designed to be stable. Your wrist, designed to be mobile. Alternating pattern of stable segments connected by mobile joints. So when you understand that, and you got a client that comes into you, and you know how to properly assess them, you know if that pattern is broken and what to attack from a mobility and stability standpoint. If you're having back pain, don't just automatically assume there's something wrong with your back, because if you watch the joint by joint approach, or the video where I talked about how the body works, a lot of times it's not necessarily the segment that's hurting that's the problem, it's what's above it and below it. So if you have back pain, that core and that lumbar area is supposed to be stable. It's not really supposed to move a whole lot, but what happens a lot of times is what's below the back, which is the hips, are designed to be mobile. That's where we should really be moving from. So if that area becomes tight and becomes immobile and is not moving correctly, like I said before, that pattern gets broken. So the lumbar area, the body's like, I've got to move somehow. I've got to do something to get over here to do this. So what it does is the lower back gives up its job, gives up its stability to become mobile, because it has to move somehow. So the lower back is doing something that's not really designed to do, and you end up wearing it out. So a lot of people, a pattern that I see all the time, especially males over the age of 40 years old that come to me, their hips are locked up, their hips don't move, and their mid-back don't move. Everything's locked up above and below the actual area that's supposed to be stable. So this area is stable, this area is stable, this area has to become mobile in order to move and get around. We need this area stable, this area mobile, and this area mobile.